So circulation, you are looking at skin, the person's skin, okay, skin color, skin condition, okay. So you're also looking at temperature, and then you're looking at the bleeding, blood, okay. So skin is very important. Skin condition, color, so very important. Temperature, skin temperature is also a very good index here. Skin temperature, so touch the forehead with the back of your hand, and then that will tell you. And then see, is the person bleeding? Okay. So this is if the emergency has touched any of these that is life-threatening, you have to call 911 in that case, and you have to follow up right away. You must do something because the person's life is threatened. That's the meaning. In other words, if I fold my hand and then wait for EMS to come and I'm not doing anything, before they come, this person may go. If there was a case, somebody shared, it happened in a restaurant where somebody was choking, severe choking. And the people called 911, for whatever reason, they didn't do anything. Maybe nobody was around, nobody knew what to do, but they did. They called 911 quite all right. So but before the paramedics could arrive, the person passed. Yes, so that's it. So first aid, again, first aid is very important. So that space, when you call, and then when they arrive, I'm talking about paramedics, it takes some time. So that is actually the space that the first aid should occupy. You're supposed to be doing something. So that situation is not going to escalate. It's not going to go worse. Because if you fold your hand and somebody is bleeding, or somebody is having a heart attack, all those signs and symptoms, or somebody is showing the signs and symptoms of stroke. Remember signs and symptoms of stroke, FAS. Face drooping, arm weakness, speech difficulty. Okay? Remember, you're supposed to add the T fast. Okay? And if you don't add the T, when FAS is present, and you didn't add the T, which is your part, this person's condition will grow worse. So when somebody's life is threatened, you must do something. For instance, somebody is bleeding, okay? You need first aid kit. You need to put your gloves. You need dressing and bandage. You need direct pressure depending on the nature of the injury or what is causing it. So you need to put pressure on it. You need to stop that bleeding. So you are not supposed to leave this terrain. You won't leave it until the situation is under control. So that is only when you can move to secondary survey. So when you are here, it means that this situation under primary survey is under control. You get what I mean? I hope it's clear, right? Yeah, yesterday we spent a lot of time on this. I'm just trying to, rehearse it because that is foundation. Okay? How well you are going to do as a first aid that depends on your understanding here. Okay, very, very important. So secondary survey is where you focus on non-life-threatening injuries. Non-life-threatening what? Injuries. Over there you do basically three main things. You take medical history. Remember sample. Okay? Remember, who can remember S means what? Have you forgotten?
S.
Yes, in sample. Remember sample. When you do medical history of the patient, simple medical history.
That's like science.
Signs and symptoms.
Yeah.
Yes, signs and symptoms.
Yeah.
A is allergy. When you ask, are you allergic?
Yeah.
M is medication. Are you on medication? P is past experience. Have you had this experience before? similar experience. L is last meal. When did you eat? Have you been eating? What did you eat? Stuff like that. And then E is what? Event. The mechanism. What happened? What led you to where you are at the moment? So that is sample. And then the next thing you do is, so here you do medical history. So sample should be able to do that for you. You do vital signs. Okay, vital signs. You take the vital signs of the patient. Vital signs. Remember there were 4 of them that we covered. Okay, heart rate. Heart rate, which is the same as pulse. Okay, we also do respiration rate, breathing rate. Okay, and then you take temperature of the patient. You don't need any equipment here. You need it back of your hand.
That's feel.
Yes, yeah, feel. Is it okay if I do that? Yes. Okay, and then level of what? Level of consciousness between 0 and 10. What number do we give this person depending on the level of consciousness? So I don't intend to go through this again. We covered this. Unless you have any question, then I can maybe pause and look at that again. So, but this the vital signs is supposed to. Usually, you do the heart rate. Okay, when you are doing the pulse, you do it for 15 seconds. Okay, and then whatever result you get, you multiply by 4 to make it 1 minute. So another thing you do here is what we call head-to-toe assessment. So if you go to chapter 11 of your book, you see that chapter is dedicated to this topic, the secondary survey. So head-to-toe assessment. So while you are waiting for the paramedics, so you can assess this person from head to toe. Remember, there are 2 types. Okay, if the person is unconscious, you do hands-on. But if the person is conscious, you do what? Hands-off. So you just give commands that walk you through the head to the toe. See how well your patient is following those commands. So those are part of things you do during secondary survey. And then ongoing patient care. Ongoing patient care. This is where you have done all you need to do, but you don't abandon your patient as long as EMS has not arrived. You are expected to stay with the patient. Reassure the patient. Okay, update the patient. Monitor the patient. So keep on reassuring, keep on monitoring. A, B, C, airway, breathing, and circulation. Periodically, always look at those 3, A, B, C, make sure that nothing has changed. Okay? So that's what you do. Keep on, if you need to support the patient manually. Okay, remember yesterday we talked about SMR, spinal motion restriction. Remember when I told you if somebody has a head injury, remember that you need to do this is called manual support. Okay, so if you need to do this while you are waiting for EMS, keep on doing it. Yeah, don't leave it. Don't leave the patient, and then the head is turning like that. That may cause more damage. So you keep on, okay. So that's emergency scene management. That is the summary of that, and this is very important. Remember that every first aid you provide, you have to go through this. And it's not dependent on the age, whether it is a baby, whether it is a child, whether it is adult, you follow the same recipe, the same template. This is just like standard algorithm. step-by-step way of doing first aid. So it doesn't matter on location, whether it is at home, make sure that you don't skip scene survey. Whether it is on the road, make sure you don't skip this. Make sure if it is in the office, you still expected to go through these steps. Yes. Okay, now does anybody have any question? Okay, yes, ask your question, please.
So under the vital signs,
yes,
the heart rate, but you said we have to give it the same, that is what you get divided, is it divided or?
No, you multiply by 4. Normal rate means over 1 minute.
Yeah.
Okay, that's meaning of rate. So, but in emergency, you can do it for 15 seconds. 15 seconds, okay? And then let's assume you get 20 in 15 seconds. Then multiply it by 4. 4 times 15 is 60.
Okay.
That's this will tell you 80. That means in 1 minute, the person's heart is beating 80 times.
Okay.
So that's how to. If you have time, you can do it for the entire 1 minute. But in emergency, time is very costly. So you do it for 15 seconds, and then whatever answer you get, multiply by 4. That will give you 1 minute. So that's what I said. I hope that is clear. Okay, any other question on this emergency scene management? Okay, I think we are good. Yes.